Thank you for the opportunity to present our work today on validation of the International Classification of Disease Critical Care Severity Score, or ICASS, using the National Trauma Data Bank. Mortality-based severity of injury metrics, such as the ICD Injury Severity Score, or ICASS, may underestimate the burden of injury in children. The ICD Critical Care Severity Score, or ICASS, is a resource-based severity of injury measure developed by our group that predicts critical care utilization on a 0 to 100 point scale. Although validated in state level data, the ICASS requires validation in a national level trauma cohort. We use the National Trauma Data Bank, two different cohorts, to derive and then validate these metrics. The predicted and actual critical care utilization and mortality were evaluated. Logistic regression was used to evaluate ICASS as a predictor of actual critical care utilization. And we compared these metrics across pediatric, adult, and elderly age groups. We used 3.9 million patients for the derivation of the metrics, and then almost 2 million in the validation cohort. On logistic regression, we found that the ICASS strongly predicted actual critical care utilization. And as expected, the ICASS strongly predicted actual mortality in a similar fashion. These figures provide the distributions of predicted mortality, or ICASS, and predicted critical care utilization, ICASS, by age group. You can see that the ICASS in blue tends to be very low, especially in the younger age groups. In contrast, the ICASS in orange tends to be higher across all age groups. This figure compares the pediatric versus adult severity of injury as a ratio. The black line at 1.0 is the line of equality. So the closer these markers are to that line, the more similar pediatric and adult burden of injury appear. You can see that the ICASS in blue makes it appear that the pediatric burden of injury is much lower than that of adults, with a ratio of 0.45. In contrast, the ICASS in orange demonstrates that the pediatric burden of injury is more similar to that of adults, with a ratio of 0.74. In conclusion, the ICASS is a valid resource-based severity of injury measure. When the ICASS is used to quantify injury severity, the burden of pediatric injury appears more similar to that of adults. Resource-based severity of injury metrics should be used to complement mortality-based metrics when evaluating severity of traumatic injury in children. Thank you very much for your attention.